Hi, my name is Ken Harris, and I'm the Executive Project Director for the Healthy Start TN Support Center. Over the last 11 months, my team and I have had the pleasure of working in partnership with Dr. Peter Glor of MIT, the Massachusetts Institute of Technology, working on a COIN initiative. A COIN is a collaborative innovation network, and it's different from a coin you may have heard of with two eyes. Peter will talk more about the coin with one eye a little bit later. But a COIN team has come together and really working around generating innovation, thoughts, and ideas, and they're working together on a shared vision. And the Healthy Start COIN consists of 10 staff members from Healthy Start programs all around the country. They represent a variety of roles, such as project directors, they are CAN coordinators, they are quality improvement advisors, and all of them are from rural and urban sites around the country. The COINs have been working to build resources that a Healthy Start CAN can use to infuse and promote health equity in their CAN and in their broader communities. The vision is that all Healthy Start programs achieve health equity, where underserved and underrepresented communities have an opportunity to attain their full health potential, and where the social determinants of health are examined and the barriers are improved, health outcomes for everyone. My team is really pleased to have worked with the COIN team and the tremendous work that they've done, and we hope that you enjoy hearing more about the COIN and the exciting products that they've been creating.
My name is Peter Glor, and I'm really delighted to give you a short overview of what COINs are, and in particular, how they will be useful for the Healthy Start project. Now, I would like to begin by talking about the difference between COINs with one eye and COINs with two eyes, because that frequently gets confused. And the COINs with two eyes, where two eyes stand for Collaborative Innovation and Improvement Networks, are different from the COIN with one eye, where the focus really is on innovation. And that's what we are trying to achieve in this particular COIN initiative, where the goal is to get disruptive innovation to address the burning needs of the Healthy Start project. COINs with one eye, they might give breakthrough results, but they are also unpredictable. And it's very much up to the members of the COIN to decide what they would like to work on. So let me now talk a little bit about what the COIN with one eye really is. And to give you the background, I started with COINs a very long time ago when I was a postdoc at MIT. And I was in the group that was developing the World Wide Web, and I was able to observe how the creator of the web, Tim Berners-Lee, was a great bee queen of starting this COIN that really changed the world, how we work together today. And he was absolutely passionate. I met him first at a conference where his paper had been rejected, where he was proposing the web. He was so passionate that he went there anyway, and he recruited a small team of intrinsically motivated people. Shame on me, he tried to recruit me also, but I turned down the invite because I thought that project would never succeed. And I had to pursue a really serious academic career. Nevertheless, he got a little highly motivated team that didn't care about money, but cared very much about making the world a better place, that developed the first prototypes of web browsers, web servers, that also convinced the larger group, including my boss at MIT, David Clark, the head of the Internet Engineering Task Force, to invite him to come to a place where he was in a position to make his vision come true. And he was then recruiting even the boss of my boss and many sponsors. And he also was getting Marc Andreessen, who was creating the first browser that was truly useful, to join the group. And so it really changed the world. And now we are trying to do exactly the same thing in the context of Healthy Start. We have already done some COINs, And I'm really delighted to talk right now about the COINs, about CANs, Community Action Networks, that have been working and producing great results over the last year. And perhaps how does this process really work? We start with an initial COIN creation workshop where we try to collect the crazy ideas, just like changing the world with the World Wide Web. We try to come up with some solutions for making CANs, community action networks, more actionable, more measurable, and give them a set of tools to make them more successful. So in that workshop, we got a very highly motivated group of volunteers, and they were brainstorming crazy ideas. We got a list of things like, should we address maternal health, infant mortality? Should we do some risk assessment in the context of COVID? And we also got the topic of community action networks. And in that workshop, it was decided that that would be the topic. And now I'm really delighted to have the two key groups that have developed great solutions and tools to show you what we have done in the last year.
Hi, I'm Jill Miller with the Alameda County Healthy Start Initiative. I work as the Home Visiting Integration Manager. I'm responsible for continuous quality improvement activities within our maternal, paternal, child, and adolescent health unit. I am also a co-facilitator for our CAN.
Hello, I'm Ronnie Myers from Healthy Birth Initiatives, Multnomah County Health Department, which is located in Portland, Oregon. And I'm just transitioning out of being the CAN coordinator, a position I've held for the last 6 years.
Hello, my name is David Lounsbury with the Bronx Healthy Start program at the Albert Einstein College of Medicine. I serve as data quality specialist for our program.
Hello, I'm Rachel Hansen. I'm with Centerstone. I'm the project director and current CAN coordinator with Healthy Start Tennessee, located in Columbia, Tennessee.
Hello, I'm Lisa Bain. I'm the director of Healthy Start San Diego.
Hi, everyone. My name is Sunny Jones, and I am the public health educator at Syracuse Healthy Start in Onondaga County in Syracuse, New York.
As a work group, we were asked to recommend a CAN assessment in helping to understand CAN progress and ability to achieve equity. We reviewed different reasons why you should assess your CAN, what type of assessment would be best, and various tools for assessing your CAN for strengths and areas of growth. What we have done is provide a resource guide with multiple assessments for CAN coordinators to review. From the list, CAN coordinators can decide which best fits their CAN and how to use those when assessing their CAN's progress.
As you heard, our charge was to create a tool to assess a Healthy Start CAN. However, we were all at different stages of assessing our own CAN. Since my site had not begun this process, this assignment allowed us to think about the process of assessment from beginning to end. Before creating our final resource guide with sample assessments, we started with a series of questions. We are sharing these questions with you because they also helped us to think more deeply about the role of the CAN and the relationship it has with Healthy Start sites and agencies. Our guiding questions are as follows. 1, why should a Healthy Start grantee assess their CAN?
Healthy Start CAN should be routinely assessed to support the aim of addressing CAN work through a health equity lens, fortify relationships between CAN and grantee, ensure that the CAN membership is reflective of key stakeholders, cultivate and sustain effective community collaboration and partnership, inform management procedures, including recruitment and retention plans, gather information that supports CAN priorities, and achieve Healthy Start performance measure benchmark.
How can a grantee assess their CAN?
Healthy Start grantees should conduct assessments of their CAN in a way that ensures accessibility to all CAN participants, considering reading level and language to ensure that information gathered will be useful to CAN and grantees. Assessments may be conducted by way of grantee structured surveys specific to grantees' need and inquiry, or they may choose to use evidence-based or evidence-informed tools. Grantees may also choose to convene listening sessions where CAN members and stakeholders come together to discuss their mission, their vision, their goals, to address their strengths and challenges and limitations and work plans.
Question number 3, what or which type of assessment can be used to assess the CAN?
The types of assessments that we'd recommend might include surveys or focus groups and key informant interviews. With regard to surveys, these are primarily grantee or stakeholder created forms on platforms like SurveyMonkey or Microsoft Forms. And these may capture data reflective of our CAN demographics, our members' skills, experiences participating in the CAN, and also ability to address the end goal, mission, and vision of the CAN. Alternately, we'd recommend using evidence-based or evidence-informed tools, existing products like the Wilder Assessment or the Partnership Survey or the School Wellness Champion Survey, which we've given examples of, or any other option selected by your grantee that is an already existing tool. Focus groups and key informant interviews are also a great strategy. This type of assessment can work especially well to engage people who you want to participate in your CAN, but who have not yet started to engage. And it kind of looks like convening CAN members or stakeholders to discuss the same mission, vision, and goals of the CAN, highlighting any strengths or challenges and limitations, the lessons we've learned, and the work plans of our CAN.
Our final question was, when should you assess the CAN? The frequency of assessment should be determined by the need of the grantee or the CAN and how the gathered data will be used. Factors to consider: the focus of the CAN as a collective and its work plan, or if you want to gather data on members, again, demographics and their experiences. Frequency of data gathering may be more frequent than the presentation of this report's finding and trends. For example, a CAN presents a survey to all of its members of the CAN to gather the initial data or baseline functioning, and then again to new members as they come on board. Or they may assess the entire CAN biannually or annually with a survey or assessment or focus group.
Our hope is that the guidance and materials we have shared can be applied as a general framework for building capacity in your own CAN. We see assessment activities like those featured here as a strategy for community engagement. Ideally, each and every assessment activity will foster dialogue with community partners such that challenges as well as successes can be recognized and acted upon in a way that mutually benefits the Healthy Start program and its community partners.
We're hoping other grantees will take a look at what we've developed and share with us any additional assessments or favorite CAN focus group questions that you would recommend for use within a Healthy Start CAN. Once we get some feedback, we'll finalize our summary and share with all grantees. Please let us know if you have a favorite CAN assessment tool you use and love. Without a doubt, the best part of participating in the COIN for me was connecting with fellow grantees. I developed really fantastic relationships and got excellent feedback that I'm able to use to make our Healthy Start site stronger.
My noted benefit of participating in COIN has been the connections and relationships built during this project over the last year, where we have often felt isolated. We were able to connect and learn from each other, as well as for other project ideas to bring back to my own project and my own site.
So the thing that I also found most beneficial about participating in the COIN was building relationships with other COIN members and taking those learnings back to my site. Connecting our data person with data people at other sites was really useful for us. We often felt isolated around our dilemmas. And so by participating on the COIN, we were able to feel less isolated and more engaged and connected throughout this process.
What was most beneficial to me was very much also meeting other grantees and being able to share what we were doing in Bronx Healthy Start and listening to what they were doing in their programs, and just comparing notes and having an opportunity to, think critically about, how to make things work better locally and then across all of the programs.
What I enjoyed most about working with the COIN was getting to know other people working in Healthy Start programs and learning from them. Really being able to learn what is working well with CAN facilitation and how we in our site can really look to improve what we're doing and increase our accessibility and facilitation. The other part I really liked was being able to talk together, share ideas, and really be creative in developing products that can help all of us operate more fully functioning and inclusive cans.
I really enjoyed working with the COIN. Being that I am fairly new to the Healthy Start program, I really enjoyed being able to work with such a dynamic group of individuals and working with teams that had a lot more knowledge with the programs than I did. It was a really fun experience to be able to just kind of have dialogue and figure out what we thought was going to be best for all of the Healthy Start programs. I think that we will be able to take back a lot of assessment tools and different innovative ways of how we can continue to grow our program and continue to serve our Healthy Start clients and the rest of our community.
In our work group, we created checklists to help CAN coordinators and members assess the accessibility of CAN meetings and activities, as well as to ensure that CAN is engaging at its fullest capacity. There are 2 different checklists at this time. One checklist identifies actions that can be taken to ensure that all stakeholders are able to easily access and participate to their fullest in CAN meetings. The other checklist outlines steps for leading the CAN through a process to identify principles of participation. The checklist can be easily modified to apply to small and large CAN groups, but all have the same end result of helping to identify strengths and areas of need for checking that the CAN is functioning at its highest capacity and is accessible to all members.
The end products are being formed from various tools and conversations with the larger COIN group. Initial research surrounded existing work on health equity, community engagement, meeting accessibility, participation and involvement, as well as reviewing the Healthy Start Epic site. After researching various different resources and tools, along with open dialogue in our large COIN group, it was decided that a checklist would be more applicable for the CAN groups versus having a narrative outlining what makes a CAN accessible and ensuring all of its members were actively participating.
So the idea of a glossary came from the COIN when we were deciding how we wanted to put together a toolkit to enhance the CANs of the Healthy Start program. Something that we all kind of discussed was that not everybody participates, and we wanted to know why. And the idea was that maybe that not everybody knows what language is being used. They don't understand some of the terminology. So we decided that having a glossary was a way to combat that problem. Once everybody has the words and the terms and the acronyms right in front of them, then they will be able to feel that they can participate more comfortably and really understand what's being discussed during the CAN meetings. And then also, all of the Healthy Start teams would be able to use the glossary as well, because the same language is going to be used amongst the staff as well as the different stakeholders in the CAN.
The hope is that these multiple checklists can be used as a guide to confirm that the CAN is operating to its fullest potential by ensuring that all members of the CAN are being heard, the meetings are productive, and all members see the benefit of their attendance at each meeting. CANs would be able to identify where they are excelling, as well as areas of need for future meetings.
Next steps surrounding the checklist would be to post to the EPIC website and continue sharing with our larger COIN group to receive feedback that will keep the checklist relevant as CANs change and adapt over time.
The feedback that we're looking for is just, again, continuing the education for the CAN and the Healthy Start program, and just making sure that the language is used amongst everyone commonly. So just adding more words and definitions to the glossary would be beneficial for everybody.
Hi, I'm Olivia Giordano Kane, and I'm a project manager at the Healthy Start TA and Support Center. I've had the pleasure of working with the COIN team and Peter over the past several months, and have been so impressed by their tremendous collaboration and commitment to equity. I know that the products they've created will be so helpful to the broader Healthy Start community, especially the many community action networks around the country. Over the next several months, our team will work with the Coin team to finalize their products and will disseminate them to the 101 Healthy Start programs in early 2022. Information about the products will be sent out via the Healthy Start TA and Support Center's newsletter and weekly update emails. If you're not already signed up to receive those, please email healthystart@nichq.org to do so. While it's bittersweet to see our inaugural coin come to a close, we're excited to hear how their products support CANs in furthering their work and commitment to equity. We're also looking forward to launching the next Healthy Start coin in 2022. Again, please sign up for our newsletter and weekly update emails to learn when that application is launched. We hope you'll consider joining.
Wow, the Healthy Start Coin team certainly accomplished a lot. Thank you for taking time to hear about the tremendous work that they've done. We do hope that you'll consider joining our Healthy Start Coin in the future.